My name is Dr. Fola Ogunbowale from the Division of Healthcare Management and Occupational Safety and Health, New York. So I welcome everyone to this meeting. Before we start, I will quickly go over our agenda. 1 minute, I have to share my screen. Okay, so thank you again for your participation at this meeting. So I will quickly go over the agenda of the meeting with all of us so that at least we'll know what we'll be talking about this morning. And as you can see on your slide, is about HIV PEP reporting and the new HIV PEP dashboards. The agenda of the meeting will be number one, HIV PEP. During this short presentation, I'll be talking about the basics of HIV PEP, and also I will delve into some information on mandatory reporting. Then after my presentation, then my other colleague, Dr. Jonathan, will be talking about the two dashboards that he will be presenting to you, and we'll walk you through the dashboard. Then after this, we'll have a session for question and answer with all the participants. I mean, if we have anybody that wants to clarify one or two things based on the presentation. So I will start. Again, my name is Dr. Fola from Division of Healthcare Management and Occupational Safety and Health, New York, from the Public Health Unit. As you know, we took over the management of the HIV PEP and HIV program in missions for the UN, for the entire UN body since last quarter of 2019. And since then, we've been doing some various work in terms of restructuring, reorganization, development of new tools for the program. All this we are doing under the guidance of the UN medical directors, because the UN medical director network, they are the one that actually decides on the strategic plan and the future of the program. So I will go briefly to give us some basic information about HIV PEP. So what is PEP? PEP is post-exposure prophylaxis. And what is HIV PEP? Because we have PEP for some other condition apart from HIV. So that is why you cannot just use the term PEP alone, because we have PEP for some other thing. So that's why we're using HIV PEP. So HIV PEP is there are medications given after exposure to HIV virus. And the main reason for giving this medication is to prevent the development of HIV infection on the exposed individual. And for HIV PEP to be effective, it must be administered within 72 hours of exposure. Because if you administer this medication after the 72 hours, the effectiveness of the medication at stopping the HIV infection is the efficiency and the efficacy of the medication cannot be guaranteed. That is why we need to do all our best to ensure that we administer this medication within the 72 hours window. Based on the current regimen from the World Health Organization, the current medication in the HIV PEP, I mean the UN HIV PEP, must be taken daily for 28 days. Daily for 28 days. So after 28 days, then the medication has to stop. So what is in the current HIV PEP kit that we are sending to duty stations globally? The current kit that we dispatched this year and from late last year up to early this year, it has the antiretroviral medications, the morning after pill, and the pregnancy test kits. The current antiretroviral medications that we have in this kit is a 3-in-1 tablet. What I mean is this. So normally you should have like 3 tablets that the individual that are taking this medication should take daily. But this one, we have a fixed dose combination of 3 active ingredients in this medication. So instead of taking 3 different medications, anybody that is exposed and they are using the UN provided kit will be taking just 1 tablet that contains these 3 active ingredients together, 1 tablet per day for 28 days. And the active ingredients are tenofovir disoproxil fumarate, lamivudine, and dolutegravir, all combined together in 1 tablet, and this must be taken 1 daily for 28 days. Then the other content are the pregnancy test kits. The pregnancy test kit will only be used when the custodian are dealing with a female UN personnel. And this is to check whether they are pregnant before initiation of or administering the antiretroviral medication. So, and once you are sure that they are not, the staff member is not pregnant and you have all the medical eligibility that's been cleared, then you can also do the morning after pill to prevent any probable pregnancy within the period when the staff member is taking this medication. So the current kit has just 1 tablet of levonorgestrel that must be taken 1 tablet only, start at the beginning when the individual is exposed. And this is just 1 time, not to be taken 1 tablet daily for 28 days like the antiretroviral. Then also in the new kit that we circulated, like the previous year, we didn't include the forms and the guidelines, but in this current kit that are currently on circulation, we have the printed UN Medical Directors guideline for the use of UN issue HIV PEP kits. So these guidelines, we printed them in the large size, French versions and English versions, and also we have smaller like booklet size in French versions and in English version. So each kit that we dispatch out have equal amounts of this guideline that accompany them. And these are the guidelines that must be issued to the clients or the personnel when they are assessing the services. In addition to the guidelines also, we also printed hard copies of the forms, the 2 reporting forms that I'll be talking about in my next slide. And the 2 reporting forms are we also printed them in English versions and French versions for all the kits that we dispatched recently. Also, in addition, in addition to the hard copies, the guidelines and the forms are also available for download from our UN HR portal, HIV PEP kit dedicated web page. All these forms and other resources for HIV PEP guidelines can be downloaded from this particular web page. So these are the 2 reporting forms, and you will know you will see the importance of using this form later during our presentation today. So the 2 forms that accompanies the kit are the custodian and patient reporting form on the left side of your screen and the physician assessment form on the right side of your screen. Whenever we issue UN PEP kits to any personnel, we must ensure that these 2 forms are duly filled by the custodian and the physician who are attending to these patients or clients. So for the custodian and patient reporting form, this is very crucial because this form has 2 parts. It has part A that must be completed by the patient, and part B that must be completed by the custodian. The reason why the part A must be completed by the person requesting the kit is because this is where they are providing their consent to the custodian that they are okay with the kit and the content of the kit being administered on them. If you look at the top part of your screen here on the form, it said the patient should complete part A and return to the custodian before the kit is given to the patient. And by doing this, he or she has read the guideline on HIV PEP kits. And also, they understand that the treatment with PEP is voluntary and that they will comply with all the follow-up that may be required of them when they are accessing these services. So it's very important for this part A of the form to be filled when we are administering this kit to any UN personnel. The part B is the section that will be that the custodian will need to fill out, and it has the basic information of the custodian, where the part A has the basic information of the patient or the UN personnel that is assessing the kits. And also, completion of part A of this form will help the custodian to do some form of administrative eligibility for the personnel before they proceed with the issuance of the form. So upon completion of these two forms, they must be sent to us at this email address displayed on your screen. All sections of the form must be filled. We've had back and forth with individuals that, oh, what about if the patient refused to give their information, their name? If they don't want to give their name, at least let them provide their initial and their other details on the form. At least you know that, and their signature. And at least you know that, okay, the individual has given them your basic information. The only thing is their names are not on the form. Then the second part, the second form that must be filled is the physician assessment form. This is required to be filled by the attending physician who is helping the custodian with the administration of the kit. And the reason why the physician assessment form must be filled is because this is where the physician will do some medical eligibility to check if the individual can actually take PEP kits, or if PEP kits will be contraindicated in such an individual. And we have situation where the custodian, they are the same as the physician. So which means they have to fill the custodian assessment form and at the same time fill the physician assessment form when they are providing this service to claims. Then on confidentiality, like I mentioned earlier, do we need to get patient consent? Yes. And that is why the part A of the custodian assessment form must be filled by the patient, because that is where you are getting the consent of the patient or the UN personnel before you administer the service to them. Then on confidentiality, all information that are collected must be treated with strictest confidentiality, because it will not be good for staff member to be hearing their information. Oh, you know, oh, this personnel actually, they are assessing the services, and before they know it, their information is out there before they even leave the office of the custodian or office of the physician. So that is why, as custodians and physicians, we must ensure that we maintain strictest confidentiality of all the information and documentation that we use when we are administering this service to personnel. Then, record keeping for PEP kit use. This is very, very important also, because if we don't do proper documentation at our hand as custodian, we will not know when we are exhausting all the kit that we have. And we may just run out of kits suddenly because of lack of proper documentation of which kits we have used, how many do we have remaining, and when did we release the kits, when we are supposed to provide the kits to other colleagues that may be requesting for them, and also when the kits will expire. For the expiration, I mean, it's okay from our side, because at least we know that the kits will all have the shelf life of 2 years, after which we will send the new kits to you. But as custodian also, it's very, very crucial and essential for you to make sure that you do proper record keeping, for you to know when your kits are expiring, and then follow up with us to see if, when we will replenish some of those kits for you. And also, so that you won't be out of stock of kits, it's always good to have good record keeping of your PEP kit usage. So, importance of reporting. Number one, like I mentioned, for monitoring and replenishing of used kits at country level. If you don't monitor, if you don't report, you will not know how many kits that you have used. And you may suddenly run out of kits, and then you have some kind of emergency that when you have a personnel that are exposed, and then you may be looking for other ways which may not be easy, like looking at Medivac, when you could have actually make a request for new kit to be dispatched to your duty station. Then reporting provides required information for planning future program. If we don't get the report from you, we will not be able to supply the kits, because currently all the kits that we are sending out are covered by the UN Medical Director Network. So if we don't have the basic information to furnish to the medical directors, we may not be able to support the program the way we would like to support the program. And also, reporting to give strategic direction for future implementation and funding of the program. Because when we get a report, we know the quantity of kits used, those that were not used, and this will help us when we're planning for future direction of the program and how we can implement the program in a much more efficient way. So this is the end of my home presentation now. And the next presentation will be about HIV PEP dashboards. And under this presentation, we'll be talking about the HIV PEP Custodian Directory and also HIV PEP usage and reporting dashboard. Like I mentioned earlier, this reporting that I mentioned earlier, they feed into the dashboards. So if we are not getting adequate report from you, what you will see during the next presentation, we will not be able to present to you, and you will not be able to have access to them, because all the resources that are coming during the next presentation are things that you can actually access from your own end as custodian or stakeholders in the management of the delivery of HIV PEP to personnel within your country. I will hand over to my colleague, Dr. Jonathan, to present on HIV PEP Custodian Directory and the usage and reporting dashboard. 1 minute, let me just stop sharing my screen.
Thank you so much, Dr. Fola. So for the next part of our presentation, I'm just going to walk you through where you can access the dashboard resources, and also talk a little bit about how you can navigate these resources for your own personal use and also for your own information. These dashboards provide a snapshot of the current. I guess they provide us. They provide a snapshot of the current situation with the program, and with just what it is that is being reported from the different forms. So where do you get access? I guess, where do you find these dashboards? This is the HR portal. The URL is hr.un.org, and you go to the Health and Wellbeing tab, and then you go to HIV and PEP. Once again, hr.un.org, Health and Wellbeing, HIV and PEP. And this is where you get the information for the HIV PEP program. Now, so there's a lot of other useful information here that you access from time to time. But the dashboards that I'm going to be talking about can be found. The custodian dashboard is under the PEP Kit Custodian section. There's an interactive link, and the HIV PEP Kit program interactive dashboard can be found under the HIV PEP Frequently Asked Questions section. So what's important is to understand that all these dashboards are only accessible if you have Unite ID access, which means if you're in the organization and IT has approved a UN email, then you have access to the dashboards. If not, you will not be able to access the dashboards. So let's look at the first dashboard, which is the HIV PEP Kit Custodian. Once again, at the bottom of the HIV PEP portal, within the HR portal, you'll find the custodian directory. So if I click this link, it will lead to it'll open up and to this particular dashboard. Sometimes when you click the link for the first time, you get a sign-in request from Power BI, which means it's just checking whether you have access to the dashboard, because access to the website is password protected, but also you will need access to the dashboard. But if you have a UN approved email address, then that should be something that it should automatically open up. So so once you click the Power BI sign in button, then this dashboard should open up, which is the HIV PEP Kit Custodian Directory. So where does this information come from? Throughout last year, we had sent a request to your offices to provide details on the individuals responsible for issuing the PEP kit, the HIV PEP kit, to pay to people that requested, and we got we got a lot of information from you regarding just who you are, how to contact you, which city and country you're in, and which organization you represent. So from time to time, this is a dynamic list. So if for whatever reason you don't find yourself on the list, if you've been added as a new custodian or you're rolling off the list, please send us an email to this link at the bottom, contact the public health team, to just let us know that you need to be added to the directory. So what is the directory? The directory is just simply who are the custodians in my city. So the reason why we chose city is because different countries have different mailing configurations. Some have zip codes, like in the US. Some don't have zip codes. So we thought that the city level was general enough to cater for a global for a global directory. So how do I then find the information that I need? Obviously, the countries are sorted in alphabetical order, which means if you're not at the if you're not alphabetically at the top, you might want to think of potentially scrolling down, which can become really cumbersome over time. However, we do have the filters on the side that can make your process much easier. So, for example, there's two ways to filter the directory. You could simply, for example, if I want to filter by country, I'd click the drop down arrow and I could point and click Azerbaijan, for example. And so everybody, all the custodians who provided the information from Azerbaijan would be listed, and you could easily find yourself in that way. Alternatively, if I wanted to, I could then search, right? I could search Azerbaijan, and then sorry for that, I could type Azerbaijan, and then only Azerbaijan would show up, and I would click Azerbaijan and I get the same result. If you do search the second way, which means if you enter text here, unfortunately, you're going to have to clear the text out if you want to see the rest of the countries, because that is important because you would reset the drop down. So if you do decide to search using text, then please clear the text in the search button for the rest of the countries in the drop down to appear. If I want to search by city, which is potentially would be the most common way. For example, if I'm interested in finding the custodians in the city where I am, with, for example, Brazzaville, I would select Braz and go ahead and select Brazzaville, and it would automatically filter. You do realize it goes to the rows where all the custodians from Brazzaville are located. So this is the way you find the information for the custodians within your city, at the city level, which is the lowest level that we went to, simply because we just wanted to find a uniform way to be, I guess, to be globally convenient. There are finer or lower levels of identification, but that might not apply to all countries. So that's the custodian directory. This is pretty much information on who are the custodians, what's their official email address, what's their office number and mobile number, which organization they are in, and what is their gender, right? So as you can see, the office numbers here are blank, right? Because the particular country, sometimes countries provide full information requested, sometimes they do not. So I would suggest that kindly after the meeting or over the course of the week, please go and take a look at the custodian directory to identify if there's any information missing for you. Remember, this information is only accessible by individuals with Unite ID access, so it's not public information, but it allows individuals within your city, the people within the UN organization, to find out who you are in case they need to access you or contact you for any PEP related issues. So there's other filters. You can filter by organization here using the same way, and you can filter by gender. But essentially, I think the most frequent use for you would be who are the custodians within my entity that I need to contact if I have any PEP related issues. So city would be something you could search by, or country, just by clicking the drop down or by using the text search button. So that would be important, because you would need potentially to clear the text if you enter it to reset the drop down. So the next thing I want to talk about is obviously so that is the custodian directory. I will I guess we will address your questions related to it at the end of this presentation. But if for whatever reason after this session you need any more information about it, feel free to use the DEMOS public health email address that's here. So once again, where do I find the custodian directory? I go to the HR portal, hrun.org, and I go to health and well-being, HIV PEP, and I scroll to the bottom, and under PEP Kit Custodians, the link to the HIV PEP Kit Custodian directory is there. What about the HIV PEP Kit program? So the HIV PEP Kit program, if I go to HIV PEP frequently asked questions on the same site, right, I see the link to the interactive dashboard for the HIV PEP Kit program. I'm going to click this link, and this dashboard is what will open up. In some cases, before it opens up, you might get the Power BI sign-in button. Once again, just click on it, and it'll show it'll give you access to the workspace if you're approved. So, for example, in this case, you can see that because I'm approved, it pops up already. But if not, you might see a Power BI sign-in button here. Just click on it, and it'll take you through to this. So, what is the HIV PEP Kit program? So, Dr. Fola has talked about how you fill in the forms and submit the forms. This HIV PEP Kit program has two purposes. It collects de-identified data from those forms at a summary level and provides you information of just what are the different usage, patient profiles, patient education, exposure, custodians, information, usage, patient profile, patient education, and exposure information from that. There's two ways to navigate the dashboard, which is you can either use these tabs at the top, or you can go down and use the Power BI default, which are the pages at the bottom. You can go ahead and click these tabs, and it'll do the same thing as I'm clicking the tabs at the top. So first off, once again, you have an introduction page which shows you the purpose of the HIV PEP Kit program dashboard. This information, once again, is strictly available only to individuals with Unite ID access. So that is important. And the first thing it does is it provides information on how many of the custodian patients, how many of the patient, custodian, and physician forms have been submitted to HQ. So this information, once again, is only for the forms that are submitted, and it shows you a trend based on time of the different, of the number of forms submitted since 2014, and you can cut this date. If, for example, you want an end of year report for the last year, all you do is just go back to the end of December, and you click that last date in December, and all the visuals update to the last of December. However, since the beginning of this year, since we're in February, three additional forms have been submitted. So it captures that information. Today is the 22nd. So it shows us that we have started receiving, once again, patient, custodian, and physician forms. We have to have all three before they entered into the dashboard. So this tells us, this is just a timeline trend of that information. So this is the number of kits used by year based on the number of forms submitted per year. Once again, and then here we have the number of kits, the number of forms submitted by entity. Right, because when you submit a form, the assumption is a kit was issued and was used. So these are the number of forms submitted by entity. Obviously, we can see that some missions have higher usages than others, but you can either scroll down, or once again, you can go here and you can do a text search, or you can go ahead and let me enter. I can pick a particular entity, and it's all going to cut based, or your information is going to cut based on the particular entity that you fix. But because I use the text search method, I have to clear the text to get the rest of the drop down back in case I make a mistake, in case I didn't want MONUSCO. And then these are the number of forms issued by country. So once again, this is just an overall level of how many forms are submitted which missions have submitted them, which countries are they coming from. This is the first page, just the usage of the kit based on the number of forms submitted. I can also have a filter. So who I guess the next page captures who are the patients, right? Once again, we made a special effort to make sure that it's de-identified, which means you can't find individual patients. But what's important is to think about what's the overall profile that we're getting from the patients. So we have this visual that shows, are they from peacekeeping missions or not? What's their gender? What is their are they staff or not staff, and what is their age range, right? Not what is their individual ages. So you can be rest assured that even if the patient is submitting their age or date of birth, we're trying our best to make sure that it's at a high enough level that nobody is concerned about confidentiality, because they're accessing the HIV PEP kits for a sensitive issue, and we want to make sure that that we can confidently reassure them that none of the information no one will be able to go back using the information they submitted to find out who they are. So sometimes you want to use these visuals for presentations at your mission level. So this is for all of the missions. This is for all of the entities. This is for all of the countries. So if you want to use once you've cut your data by mission, by gender, or so on and so forth, maybe you might want to use the visual for a presentation. How do I do that? Obviously, I can't. What I would do is I would go to the top and I'd select this, what's called a focus mode, right? So I'm going to focus in on the patient. Is your patient from a peacekeeping or political mission? And so when I click the focus mode, then it magnifies the visual. Then I have this copy as image with caption. So if I copy this image, I can paste it into PD. I can paint it in PowerPoint. I can paint it in Excel. And some of you who are familiar with dashboards might ask, why don't we have the export feature available? Because you're accessing the dashboard to the web, that is not possible with the current, I guess the way currently Power BI works. Maybe in future they might update that option. However, if you do need to export the report, once again, just contact the public health team, let them know which entity you're from, and they can export the whole dashboard on your behalf. But for those of us who are using it through the web, once again, if you want to use the visuals of presentations, just go ahead once again, click the focus mode and copy this, and you can paste it in whatever other application that you're using for your presentation. So this is the profile of the patient. Once again, you can cut the profile by male or female if you'd like. And I guess that allows you to then go ahead and you can see when I clicked male, all the genders, like every person in the gender column is male, so that shows you the accuracy of that particular filter. But essentially, in that case, if I just deselect the button, then it defaults back to the previous format. Once again, if I don't select, if I don't do a text search, then all I do is just deselect to get back to the original visuals. So the patient profile section, once again, gives a high level information of who are the people who are requesting the PEP kits, right? Are they peacekeeping or not? What is their gender? Are they UN staff or not? And what are their age ranges? So you can see ages and age. Some people are sensitive to report their age, but we do our best to get what we can, right? But luckily for us, the majority of the data set has age reported. So what is patient education? Patient education is based on what are the custodians or what are the physicians, right? How are they informing the users of the PEP kit of how to use it, right? So before we get to that, the patient obviously fills out in the patient form, why are you requesting the PEP kit? right? And we have the profile here from the patient response. There's two questions here: patient, why are you using the PEP kit, or the custodian, why are you issuing the PEP kit? This captures the patient response. We feel that that is the most accurate way to determine why do they want the PEP kit from their own, I guess, from their own responses. Then the second visual talks about whether the doctor provided instructions on antiretroviral usage. So once they go to the physician, then they're given and do they get instructions on antiretroviral usage? So this question was an addition, and we can see that while the majority of individuals indicate yes, there's a high number that indicated unknown. This is because this was a new question that was added after 2014, right? So what's going to happen is everybody that did not submit a previous response because it wasn't available in their forms, we just capped it as unknown. So don't get too worried about this. Yes, what's going to happen is over time, as we get new PEP kits, this number will remain static, but overall the height of the bar will go down. We'll get more information. So this was just a new question, which means you have a high number of individuals that they were not able to fill in whether their doctor provided instruction antiretroviral usage because it wasn't available in their form. So, however, this was an old question that asks, if you received antiretroviral usage, what were the topics? Right? So this breaks down essentially what is it that people get instructions on. Obviously, the importance of follow-up. Everybody's making sure that the individuals that request the PEP kit get information on the fact that they need to come back within the medical approved time to determine how they're doing. So this is just a breakdown of other topics that the patients are educated on by their physicians. So this is just also this is a useful tool for us just to know at a high level, are they getting the education on usage for the effectiveness. We do have a next page, that's the exposure page, right, that talks about was your PEP administered within 72 hours of exposure? We've just heard that that's important. Obviously, this all comes from the form that's submitted, which is why the submission of the forms is so important, because then we can get a snapshot picture of just the way that the program is operating. So we see that while the majority of the PEP was administered within 72 hours of exposure, there's a high number of unknowns here, even though this is an old question. So it's important for us to also just make sure that I guess we capture whether this information of whether the PEP was administered within 72 hours of exposure. We can see from this section that the majority of exposure is non-occupational, which means it doesn't occur in the workplace, right? And that's important because then we can think of how do they get exposed when they're not at the workplace. So obviously the traditional way that individuals get HIV. However, we also see that needle stick injuries are also part of the ways that individuals get or not really get, but are at risk of exposure to the virus, both in the workplace and offsite. But we can rest assured that in the workplace the risk of exposure is very low, and that's reflected here. So these 4 tabs, the usage tab gives us information on who uses the, I guess, on who requests the PEP kit. You can cut it by time, you can cut it by mission. If you don't want to use the calendar, which I advise, you can always just come back and you can actually type in the date here. So for example, if you just want to know last 2 years, what has been the usage, you're not interested in all the information from before, you just enter from 2021 to 2023, and it cuts across all pages. For example, because I selected this date here, it's synced, which means if I cut the date here, it's going to be cut on these other 2 tabs as well, right? So you don't have to come back. All the tabs, all the filters are linked. So if you change it on one page, it changes on all the other pages, which is convenient because then you don't have to keep track on each page of what filters am I looking at, or what data set am I looking at. But also you have to make sure that if you do want to reset, then you go ahead and make sure that you revert your visuals back to the original position, right? So and that's important. So now that we've finished with the information from the PEP kit forms, which are on the first 4 pages of the dashboard after introduction, these directly come from the forms. So usage, patient profile, patient education exposure, all this comes from the patient, custodian, and physician reporting forms that you submit to HQ. So what is the custodian's page? So we just saw the custodian's directory, but sometimes maybe you want to know from an overall level I guess which countries are the number of custodians, which entities do they represent, and this is a separate page from the first 4, but it just gives you an overall picture visually of just the same information that's in the custodian directory, but using visuals to represent that. Once again, the purpose of this HIV PEP kit program report dashboard is to give an overall view or a snapshot picture of the program, right? So that's why we want to know exactly who's involved, who are the patients, and then we also have the administration page that talks about just how many PEP kits have been delivered, what's the expiry date, right? According to which program cycle, but this is not from the patient reporting form. So all this information is reported directly by the entities, or is captured by HQ prior to sending out the PEP kits. So these ones this is pretty much the countries that have received PEP kits, or the PEP kits have been sent to. This is the number of PEP kits sent out by program cycle. So right now we're in the 22-23 program cycle. So we can kind of see that once again you can cut the filters using this. However, I want to talk about this visual a little bit more, so let me focus on it. Once again, it's important if you want to go ahead and use the information on this dashboard for presentation outside of your personal use, then the way you do it is you hover over a visual, you go to focus mode, which is an icon that appears above the visual. You click on that, and it magnifies the visual, and you go ahead and copy the image, so that and then you can paste it in PowerPoint or whatever other presentation app that you're using. However, this information is reported from you. It tells us how many of the PEP kits went unused, right? So this information doesn't come from the form. So this just tells us exactly what is the usage of the form, and it's important once again to think about, just for example, that it's the usage of the form is not driven by the custodians, right? It's whether individuals come and request the forms. What's important is for the custodians to be available to issue the forms when they're requested. So this is not a metric that says no, you should use more PEP kit. You should make sure this number is high. What you want to make sure is that you're available, so that this number of unused is not driven by a lack of access to a custodian, because once again, the PEP kits are requested by the patients. The direction of the request comes from the patients. And then we have this nice little there's a lot more data on the patient, custodian, and physician reporting forms, but what we want to do is essentially just give you a snapshot picture of what we think are the most important things to look at a first glance. But if you're interested in other information, obviously you can cut the data in the Q&A section and get table information, not visual information, on other things. For example, if I want to ask, this is like kind of like this patient, you can say peacekeeping. So this is just a list of questions. For example, is patient from peacekeeping or political mission, and then you can cut that by age range, and you get a neat little table that tells you, okay, so this is from the raw data. What does the raw data look like for that? But this is something that is essentially something for your personal use in case you want to cut the data in other ways. But what's most important is just the structure of the HIV PEP kit program report that you'll be using. So I just wanted to give you a high level understanding of how it's structured, which is the first 4 pages are information. The usage, patient profile, patient education, exposure pages are information we get from the forms, right, that you submit, which is why it's important for us to make sure that we submit the forms. And the custodian is just a visual of just what's the gender of the custodians, where they're located, and administration is just telling us from a high level who has received the PEP kits, how many PEP kits were delivered, and how many went and used. But these 2 pages, the custodian and administration page, these are not from the forms, but from other reports that capture this information. So the introduction page is important because it tells us just how do we contact Dimash in case we have questions, right, which is important. But once again, both the custodian, both this dashboard and the custodian directory dashboard are all available at the HR, through the HR portal. And what you might want to do, obviously, if you don't want to go through the process of accessing it through the way I just did, which is I type hr.un.org first, which is what you would do, and it would get us to the HR portal, and then I'd have to health and well-being, HIV and PEP. What you might want to do is when you do access the dashboard, just bookmark it. So whether it's the HIV PEP kit program or the HIV PEP kit custodian, just go ahead and bookmark it so you can directly link to it. Because sometimes you might find that because of some update or some maintenance that's going on over the weekend, these dashboards can be down, and you might still need to access the these websites can be down for maintenance over a weekend, and sometimes you need to prepare for presentation or something based on this information that you have, or sometimes you might need to find a custodian, right, over the weekend when the site is down. So it might be important just to bookmark this so that you have it available. So I don't have anything else to add, but I'm going to hand back over to Dr. Fola in case, just so that we can answer your questions if they have any.
Thank you so much, Mr. Jonathan, for your presentation. I've been responding to a lot of questions in the chat, and they are quite interesting. Like in terms of access, people are asking can they have access to the directory and the dashboards? And my response was that if you have the Unite ID, normally you should have access easily. But if you are from organization that doesn't use the Unite ID, the way to access it, you need to make a formal request to us, and then we'll provide access based on this. And also for some organizations, their UN medical directors, they've actually been making requests to have some of their personnel to have access to the dashboard, and we have been providing these. So, but if you have Unite ID, you will be able to have access. The reason why we are not making it something like an open web thing is the information here, they are still, though I would say they are still sensitive, but we just don't want anybody that just pop onto the UN webpage to just have access to it. That is why you need to log into with your personal details before you can access this information. And also, some of the question was that why are we not making HIV testing mandatory before we provide kits to personnel? And for this, that is why it is very, very essential to have a physician assessment. Because, for example, now during the physician assessment, the physician will have, or the healthcare provider will have asked some basic questions from the client to ascertain their previous risk before the current exposure. So based on what the physician find out, then they will now decide if they need to administer a new HIV test to know the status of the client, or if they can already administer the kit. Because, for example, now individuals know themselves. Because if you look on the form, there was a place where the question was asked: when were you last tested for HIV? Were you involved in some risky behaviors? So these are things to actually help the physician to decide whether a test would be required or not. Also, there was a question that why are we not providing the peacekeeping mission HIV PEP kit? It is because in some of the peacekeeping mission, they have a unit that actually deals with this, and they are not part of the UNHP supply kit, except in some mission that doesn't have a unit that deal with this program. In mission where they have this program, they do direct procurement of their own kit. What we just do, we provide technical guidance on the type of kit to procure based on the information from WHO in terms of the content of the kit. And somebody asked a question: what if the person trying to access the service refuse to provide their names, they refuse to provide all the information? Should they administer the service? And the thing is this, it's like you are administering the service to a ghost. How can somebody walk up into your clinic and they are not telling you anything, and they're just telling you, I need this medication? We are giving medication to people. This is medical consumables. And some of the medication, they have side effects, especially the antiretroviral. So you need to actually get the basic information from the patient. Even if you are not transmitting the information to us, at least the initial, and from your own end, you know the name of the patient, the organization of the patient. Even if you are not including this on the form, at least the initial and the basic information. And then also, you need to ensure that you actually clarify to the patient that all the information that they are providing, they are highly confidential, and it's not going to be disseminated to anybody, including their manager. Because staff member may be afraid, oh, what about if my manager or somebody come and ask for this information? Normally, during my presentation, I mentioned something that we need to ensure that we maintain very strict confidentiality of all information and documents that we are collecting when we are administering these services. Which other question? 1 minute. I'm looking at the. I responded to virtually almost all the questions in the chat already. So I'm trying to just look at them again. But if you look in the chat, you see that I have actually answered most of the question. 1 minute. Yeah. Okay. Somebody was saying, what about if the kit expired? What should they do? That how would they know when to replenish the kit or to what to do? So the thing is this: since this is UN supply PEP kit, we know the expiration date of this medication. We know that the current kit in circulation now will be expiring by between June and July next year. So, and we know what we always try our best to ensure that we replenish all this or replace all this expired kit like a month before the expiration of the current kit in circulation. So from your own end as custodian, what you need to do is just to ensure that you are not, you don't have stock out of the medication of the kit. So as long as you have the kit at your own level, for the expiration of the kit, we are dealing with that from our own end because we know we are the one that will supply the kit. So we always make sure that we supply the kit. I mean, all the previous cycle, we do the supply of the kit like a month before the current kit will expire, so that at least there will not be a problem of stock out of kit while we're trying to provide this service to personnel within our missions. So there was another question on how to access the kits. How to access the dashboards. Some people are actually trying to access them already, and they're like, oh, they are not able to access it. The reason, if you have a Unite ID, like I mentioned earlier, you will be able to access it. But if you don't have Unite ID, we need to get a request from your entity to provide access. That is when we'll be able to provide access. And this is to ensure that not just anybody can just pop into the web page and then start accessing all those information on the page. Also, Jonathan, you want to say something?
Yes, just quickly, for the access issue, when you click the sign in button and it asks you to request access and you click the request access button, then we receive it and we review it and then we provide access. So for those of you requesting access, we're receiving them in real time as we're in the meeting. So after the meeting, we'll go through it and you'll potentially get access before the end of the day.
Okay. Okay,
Thank you,
so
Dr.
somebody mentioned that in many duty stations there are no physician. There are no physicians. Custodians are security officers and can do the physician assessment, as well as they don't have access to HIV testing. So they shall go straight to administer the PEP kit. It is not going to harm if given to people. Okay, so in duty station, where if you look at the UN HIV PEP guideline that we, like I mentioned earlier during the presentation, that is in circulation with the current kits, there's a section of it that actually addressed this, that in duty stations where there are no physicians, the UN Medical Director decision was for the custodian to reach out to a physician on the phone, who we already have a copy of the physician assessment. If you look at the physician assessment, most of the, if you look at the physician assessment for most of the information there, they are like questions that will be asked, and they are like tick box that the physician can actually do at a distance. And based on the information that the physician might have asked the client, then they will advise the custodian either to provide the kits or either to do further tests on the client before they administer the kit. And mind you, all this must be done within the 72 hours window. So people are asking whether we will provide the link for this presentation. Yes, definitely after this meeting, we will provide the link for this presentation. We'll also share the slide. And also, like as usual, all this information will be posted on our UN dedicated HIV PEP webpage. And in addition to that, there will be a separate recording walkthrough on what Dr. Jonathan has presented. And if you go back, it will show you how to actually navigate on the directory and also on the dashboard. So there will be a separate recording that you will be able to access on the UN HR portal. And okay, somebody also asked that the names of their custodians are not on the directory. So for this, the current information that we have on the directory, they were the names and the details of custodians that were provided by the UN HIV PEP FOCA for each of the country. So if, and this is what we have been asking them, they can always send us names of additional custodian if they want to add more or if they want to remove from the page. So what I will ask us to do is, if we have any organization in this meeting and you realize that your organization name is not on the list, or you are a custodian and your names are not on the site already, so just write us using the HIV email address, and then we will see how we can actually update the list based on the request that we receive from the from different locations. I think I covered most of the question. For the access, if you're having problem with access, please, I will ask you to write us separately, and then we can see how we will be able to support you on this. And most likely, if you are not having a Unite ID, you will not, or you may not be able to access the directory and the dashboard until we give you access. Otherwise, I think we covered most of the questions. And Jonathan, you still have any another clarification to make?
Yes, just quickly. I see there's a lot of questions about what if the patient doesn't want to provide their name, because we don't use their name for the dashboard anyway. Try your best to find a way to. I mean, even if they don't provide their name, you might just want to maybe like Dr. Fowler said, the initial, or even if it's not the initial, try to get the rest into the information as accurately as possible, because then we can just put their name as unknown, because I guess the system generates an ID anyway, right? So don't let the fact that they don't want to provide their name prevent you from giving them access to the healthcare service?
Somebody was asking that how do we train the physician? If you look on the HIV web page, some of our previous training, I think we had a training early 2020 that we recorded then. It details how to fill the forms and the steps to take when you are filling the form. You can always watch this video, or you can send the link to the physician for them to watch how to fill the forms. Yeah. Otherwise, I think we are done for now. Thank you, colleague, for your support and for listening to all that we have been presenting to you. Like I mentioned earlier, we will share the recording of this presentation to everybody, and also we will share all the required resources attached to this presentation to all the participants. And also, once we are done with the recording of the walkthrough for the directory and for the dashboard, we'll also share the link with all the custodians so that at least you can have access to it. And for those that are having issues with access, you please endeavor to drop us email using the HIV email. 1 minute, I'm trying to type the email for us. Yeah, so please try to send us an email, and we will be able to provide support on how to access the directory and the other resources. Thank you so much, and then we'll be getting back to you for future presentation on on anything on HIV in due course. Thank you so much. Really appreciate your participation. Thank you. Have a nice day. Thanks.
Thank you so much for attending. Goodbye.
Okay. Bye-bye.